So this project is going to achieve for the Q community, the first time we'll have a common language or a common framework that describes and breaks down improvement into a set of key dimensions. We're building a lot of research that's been done before, some of Joy Furnival's work, and we'll expand on that. But we'll create a product that can be used by teams to sit down and discuss where their strengths are. And then the magic of the Q community comes in when we can find particular strengths and work as a bit of a brokerage service, connecting somebody with a desire to improve on a certain area with someone who's got a strength to share. And we can take that further into a trust setting and have a trust self-assess a particular team within there and create their own set of scores and capabilities, and then bring that data back into the Q community and broker it to find somebody they can learn from. So really it's the gift that just keeps giving. So why would you not vote for the frog?
The NHS is responsible for 25% of greenhouse gas emissions in the UK, and operating theatres are 6 times more energy intensive than the rest of the whole of the hospital. So this study seeks to improve the sustainable value of surgical operating theatres, and that's through balancing patient and population outcomes against the ecological costs, looking at carbon footprinting, social costs, in particular looking at labour rights abuse risks within procurement chains, and also financial costs, so looking at ways of leaning the operating theatre.
We've got plenty of evidence that shows that 230 million drug errors are caused each year and 700 deaths. This makes us passionate about trying to improve patient outcomes. So our project is going to run a pilot that's going to show us the acceptability, feasibility and safety of using peer support in this way. We want to, in running this pilot, we want to empower patients and to improve medication safety.
My project aims to embed Coordinate My Care into the care home sector. Coordinate My Care is the only electronic record that's accessible by all healthcare providers 24 hours a day, and it enables coordinated care between the patient's GP, the ambulance service and the community and acute settings. With your support to win the funding, we aim to give care home residents a platform to have their voices heard and to have a coordinated care record which is accessible by the care home staff. This will allow us to treat the resident with dignity, respect and prevent avoidable hospital admissions. Our ambition is to bridge the gap between health and social care to help revolutionise the care home sector with the added benefit of considerable cost savings. So please vote for us.
Speed dating is all about making it really easy to find your prince or princess charming. Our project, called Speed Dating, is all about making it really easy to find your prince or princess charming of data. National Clinical Audit provide a wealth of information, a treasure trove really, to help you improve the quality of care in your trust. With your support, we want to make this tool the go-to place for people looking for one-click access data to help them improve the quality of care in their local hospital. I really hope you can give us your support and help us find your princess or princess charming of data.
With this project, we hope to achieve to spread the learnings from the Improving Pediatric Sepsis project that has been running for a year across London, across England or across the UK. The recognition of sepsis in children is a big challenge even for experienced clinicians and healthcare professionals. So there's a lot of learning from different regions in England, a lot of expertise being held in acute care and primary care as well as community care. And by exploring and bringing them all together, we hope to achieve to spread the learning, to build on the regional learning and to spread it across England.
So we're all agreed that patients should be partners in improvement teams. And what we want to achieve from our project is that they'll be confident to maximise the benefit of their contribution to the team. And we'll be doing that by giving them peer support to develop the skills of a national peer network to support local patients as partners in improvement teams.
We hope to achieve a credible evaluation tool for people. We're hoping to capture evaluation that is credible and valid amongst the academics. We're often told that the creative approaches that we use is soft and fluffy, but we know the true value of how it makes people feel. It also empowers people to evaluate their own projects from their point of view. And we want the academics to see that there is real value to the creative approaches that we use in mental health and across the board.
With this project hopes to achieve the sort of co-development and design of a bespoke training package for patients, communities, families, the public on getting involved in quality improvement within trusts or community organisations. What we want at the end of it is different ways of delivering training so that patients feel very confident to get involved in our QI projects or to lead QI projects or to suggest ideas, and to have a resource pack that people can share, take away, use, both within our area and elsewhere.
We hope to map the healthcare seeking behaviour of patients who frequently attend the emergency departments throughout the Thames Valley region. It's a collaborative project between 5 different localities. We will also assess what interventions have been put in place by the different services to better meet the unmet mental health and psychosocial needs of this patient population. Ultimately, we want to come up with a best practice approach, and this will be inclusive of both NHS and non-NHS stakeholders. Very important is to include the patients, the carers, but also of course GPs, the ambulance service, police service and others, to improve the quality of care we provide to these patients.
Our project hopes to achieve the testing of the use of a tool to support domiciliary care staff in recognising the softer signs of deterioration, improving response and communication to colleagues or health professionals using the SBAR communication tool. The aim of the work is to reduce avoidable harm, enhance clinical outcomes and reduce hospital admissions, and improve the experience for individuals receiving domiciliary care. Better recognition and response across pathways of care would benefit individuals with complex needs living in the community.
Our project came about after a challenge by our programme board on how to enable people and organisations to bring about transformational change in the short, medium and long term. The Toolkit supports teams through a facilitated workshop to enable the process for transformational change. We carried out a full feasibility study which identified a gap in the market for the toolkit, and people saw great value in it and were keen to use it. Please get in touch to let us know how you can support us. Thank you.
Our project tackles a significant problem. Young adults face barriers accessing health services. This leads to poor physical and mental health outcomes, something that's especially prevalent in diabetes. We need to think differently. We need to think about treating the young person rather than treating the condition, and we need to work towards a culture of solidarity where patients and clinicians work jointly, not just to design the service, but also to deliver it. Our project will co-design an improvement resource to help health professionals bring peer support closer to usual care. We will draw on lessons learned from our ongoing series of group clinics, also from academic and grey literature. We're also going to include improvement and coaching expertise, as well as develop a consensus process with Q members. Our resource will be transferable to other clinics and other conditions, and it's going to fill a gap in supporting health professionals to realize the full potential of peer support in their clinics. Please visit Stand 13 and vote for our project.
This project aims to co-design the use of NHS Near Me with patients. So NHS Highland is a large geographical health board. Patients have to travel very long distances to attend outpatient appointments, and they told us it wasn't good enough. We agreed and we created NHS Near Me. Primarily we started in local clinics, so patients can attend a local clinic for a video appointment with their consultant. The next stage and why we're here is to create an at-home service for patients, so patients can attend their appointments from their own homes. We want to co-design it with patients to ensure that patients can access the service in the easiest way for them, and so they can be supported to make decisions around the best way to use a video consulting service.
So what we hope to achieve looking at carers and peer support is to raise the profile of unpaid carers, to look at the value of what peer support means for carers in their own words. So it's carers speaking to other carers to find out the value of peer support. So it's giving carers an opportunity to answer a question about themselves in a way that they've never been asked it before, speaking to their peers to talk about what that experience means to them and what the value of it is. It's a question that has never been asked before. There's no evidence out there about the value of it, yet everybody talks about the value of carer peer support, and what we want to show is what makes it valuable to carers, not to commissioners or staff, but to carers themselves.
So this project has all come about from the transformative experiences of the project team, but also from service users who've told us that for some people, the experience of being on hospital wards can be more traumatic than the experience of psychosis itself. We need to change that, and we think peer support is a really good way of doing so. So we're going to have 6 workshops with people who've experienced psychosis, people close to them, staff on those wards, and peer supporters who are going to design a new intervention for our area to improve support for people on wards.
As a GP, I often see people with problems that are not medical in origin. Think about people who have type 2 diabetes and may be overweight, or teenagers who are self-harming. At the heart of our Churchdown Connections project is our belief that people want to be activated and connected up to the things that are out there in the community, rather than always medicalising their problems. And so we are wanting to take a coaching approach to help connect these patients up to the solutions that exist for them already in the community.
So our project hopes to achieve a shift in power between hospitals and its communities by training hospital staff, patients and local community members in community organising tools and techniques to be able to work together to identify unusual suspects within the community who can listen to their community to identify what issues around health that they care about most, and then work together as a team to be able to deliver those changes. Those changes might be issues around youth violence, for example, in North West London, and then we hope to develop tools, relationships that the Q programme can then utilise around the country with the Citizens UK alliances that we have.
Our project hopes to achieve looking at the evaluation of QI training in Northern Ireland and the UK. Much investment is made in QI training, but very little evaluation beyond the impact of learning and skills. Our project is a collaboration with universities, trainers and care providers looking at the impact of QI training. We hope to devise a transfer resource that will be used by organisations to support their staff who have undergone QI training. We hope that this will take the gamble out of the investment that is made in QI training.
Hi, I'm Bettina Klutkens. Our project is the Quality Improvement Partner Panels. What our project hopes to achieve is that we want to revolutionise the way patients and the public are able to contribute to quality improvement projects in the health and care system. We're going to do that by training them in quality improvement methods, and we will then enable them to work together, learn, share and network, and become active partners in quality improvement.
This project is to take an approach across Wales first and improving the repeat prescribing process in GP practices. This will release time for clinical staff, improve safety for the patient and improve efficiency. We then hope that we'll be able to take the materials and share the learning, not just in Wales but across the UK. Voting for us means that these efforts won't be duplicated across Q.
We hope to make a real difference within primary care. With an increasing ageing population, we know that the burden of MSK on primary care is huge, and we aim to create a network that will engage and will promote self-management of MSK. We'll do this through creating a patient champion network, through building training resources and an implementation toolkit around making every contact counts for MSK. And we'll also work hard to look at how the patient champion role can work with care pathways within the NHS to make a difference, This model could then be rolled out to other health conditions within the Q community members for them to use more widely across the region and nationally.
So with our project, we aim to achieve, quite frankly, a sea change in how we use data in the NHS. Moving away from that red, amber, green, metric-y, good, bad, carrot and stick approach to using data, moving towards something where we can plot our dots over time, understand our variation and respond appropriately.
We hope that our programme will give the Q community and the wider health and social care systems a model that they can use to understand flows across their care systems in order to improve them. We've designed this model with patients, with operational managers and improvement practitioners, just to try and make sure we understand how we can apply improvement methodology across care systems in this very complex area and try and look at the problem of flow across our systems.
What I hope to achieve through this project is, through the Q Community Time Bank, maximising the potential of the Q community. The Q Community Time Bank benefits from a lot of the principles that Q is built on, the ability to gain wisdom through crowds, connecting and learning from one another. Oftentimes, if you first join Q, you're not quite sure what it's all about and what you can gain from it, whereas this way there is a systematic approach you can use to putting out requests to other Q community members, and also, if you have an offer, putting that out as well and contributing to other improvements, and thereby building on our natural strengths, building the cohesion of the Q community, and naturally improving our benefits such that we become greater than the sum of our parts. And so I encourage you all to join the Q Community Time Bank, give an hour, get one back.